Hello everyone, we are from Taylor's University from the course Advanced Pharmacology and we are from Group 6 and today we'll be presenting about Ranitidine-Zantac. These are the content outlines for our presentation today. Following are the team members of Group 6. Right now, let's look at why is this person required to take ranitidine. Ranitidine is utilized to treat stomach and intestinal ulcers with the dual purpose of healing existing ulcers and preventing the reoccurrence of it. It targets specific issues in the stomach and esophagus, including erosive esophagitis, gastroesophageal reflux disease, and also Soldier-Ellison syndrome. Its mechanism of action involves reducing the production of stomach acid, providing relief from symptoms like persistent cough, abdominal pain, heartburn, and also difficulty in swallowing. It is classified as histamine H2 receptor antagonist. Ranitidine belongs to a category of drug that effectively alleviates symptoms related to excess stomach acid. It is also available over the counter, aiding in the prevention and relief of heartburn and associated symptoms caused by overproduction of stomach acid, also known as acid indigestion.
Hello everyone, I'm going to discuss about the pharmacokinetics of this drug. Absorption. Ranitidine bioavailability is 50 to 60% due to liver metabolism. It is rapidly absorbed, reaching peak concentration 1 to 3 hours post-administration and varying significantly among patients. Food or antacids play a small role in its absorption. Volume of distribution. The volume of distribution is higher than body volume and measured at approximately 1.4 liter per kg. It concentrates in breast milk but does not rapidly distribute into the cerebrospinal fluid. Now let's proceed to the protein binding. There is a plasma protein binding of about 15% for ranitidine. Metabolism. Noxid, a metabolite of only about 4% of the dose, is one of the major metabolites in urine. So oxygenil 1% and desmethyl ranitidine 1% are other metabolites of ranitidine. The remaining doses of ranitidine have been released into the feces. Liver dysfunction have been shown to cause small but clinically insignificant changes in various ranitidine pharmacokinetic parameters.
Now I'll be presenting the drug mechanism pharmacodynamics. What is the drug mechanism of ranitidine? Gastric acid secretion is reduced as a result of ranitidine's competitive and reversible inhibition of the action of histamine at the histamine H2 receptors located on parietal cells in the stomach. In addition to capsules, tablets, oral syrup, and injectable formulations, the medication is also offered in capsule form. The half-life of ranitidine is between 2.5 and 3 hours, and it is mostly eliminated and unchanged in the urine. It is predicted that serum concentrations between 36 and 94 ng per ml are required to block 50% of induced stomach acid production. Several factors such as competition for absorption have been linked to ranitidine, reducing the bioavailability of other drugs. Now I'll be moving on to the next person.
Now let's talk about the side effects of ranitidine. Ranitidine is usually well tolerated and do not cause adverse side effects. However, some individuals may still experience certain side effects such as headache being the most common, constipation or diarrhea, drowsiness as well as dizziness. In some cases, individuals with other underlying health conditions may experience more serious side effects such as hair loss, jaundice, changes in heart rate, and easy bruising, though these occurrences are rare. If any of the side effects last longer than 2 days, or if any of the serious side effects occur, individuals should consult their doctor as soon as possible to rule out the cause. Now, I'll be passing on the presentation to the next person.
So I will now be talking about other alternatives of Zantac. First, there are PPIs, also known as proton pump inhibitors. In an irreversible manner, PPIs can prevent certain enzymes from secreting acid into the stomach. Several PPIs are recognized by the FDA as safe and effective alternatives to ranitidine, such as esomeprazole, lansoprazole, and omeprazole. Furthermore, as an alternative to Zantac, antacids may also be used. The stomach acid can be neutralized by taking two well-known antacids such as Tums and Rolaids. Moving on to the next slide, Zantac alternatives also include H2 histamine receptor antagonists. To prevent histamine from activating cells in the stomach lining to produce and release acid, the FDA has approved H2 histamine receptor antagonists such as famotidine and cimetidine to be safe alternatives to ranitidine. So in this slide, I'll be discussing about several Zantac-free options such as dietary and lifestyle modifications. Medications are not the only way to deal with heartburn, but making some changes to your diet and daily routine would help as well. Some examples are by keeping away from fizzy drinks, cutting down on spicy food, and also staying upright after a meal. That's all from me, and I will now be passing it on to Niveta.
So now I'll be talking about the interesting facts about ranitidine. So firstly, it reduces stomach acid to treat peptic ulcer disease, reflux disease and Zollinger-Ellison syndrome. Second, ranitidine is a hydrogen blocker, indicating it works by preventing the body from producing more of the chemical histamine, which causes the stomach to produce more acid. Third, NDMA is a recognized environmental pollutant and is found in water, foods, meats, dairy products and vegetables. Fourth, ranitidine's most frequent negative effects are gastrointestinal, and it includes nausea, vomiting and diarrhea. Fifth, this drug is available without any prescription. It treats and prevents acid reflux. Lastly, before stopping ranitidine, patients should consider alternate treatments with their doctors. This is our reference list. And that's all from us. Thank you for watching.